Miraki everyone, welcome to Fundamental of Nursing RLE Rationalization. Okay, first question. Nurses should be aware of the factors that can affect a client's body temperature so they can recognize normal temperature variations. Look at the question, guys. Look at the stem of the question. All of the following are the factors affect body temperature except. Okay, there's a modifier. Meron tayong modifier na except. Ang tinatanong class, factors that affect the body temperature except. So, naghahanap po tayo dyan ng negative because of the modifier except. Okay. Is age a factor, okay, that affects body temperature? Of course, yes. The infant is greatly influenced by the temperature of the environment and must be protected from extreme changes. And we all know elders are at risk of hypothermia. So, kasama yan sa mga factors. How about, sir, your hormones? Definitely, women usually experience more hormone fluctuation than men. Diba, sa babae, progesterone is secreted at the time of ovulation, kaya tumataas ang kanilang body temp by 0.3 to 0.6 degrees Celsius. Ayan. So, kasama yan. Obviously, kasama din ang ating tinatawag na stress. Of course, kasama din yan. Okay? Bakit, sir, kasamang stress natin? Remember that the stimulation of your sympathetic nervous system, it can increase the production of your epinephrine and norepinephrine. So, tumataas ang ating metabolic activity. Kaya tumataas din ang temperature. How about, sir, urinary variation? Kasama ba yan? Guys, okay, urinal, hindi yan urinal. It should be the urinal variation, not urinal. Or yung tinatawag natin your circadian rhythm, okay, na tinatawag. Mag-ingat kayo, nakalagay urinal. Okay? Ano to? Typo error? Hindi. Maliwanag yan na urinal ang nakalagay. Your circadian rhythm na tinatawag po natin. Okay? Your body temp normally changes. Okay? Ang body temp po natin, nagbabago po talaga yan throughout the day. Ang highest temperature daw natin, highest temperature according to Kojir, highest temperature is usually reached, okay, highest temperature is usually reached between, okay, between the hour of 1600 to 1800 hours. Okay? Yan yung military time, 4 to 6 p.m. Kasi minsan sa mga exams nyo, class, okay, nakalagay 1600, 1800. So, kailangan ka masanay dyan. And yung lowest daw natin, class, okay, your lowest temp is reach, okay, between 4 to 6 a.m. Between 4 to 6 a.m. Okay? So, the question, let's go back to the question. You are being asked, all of the factors or all of the following are the factors that affect the body temperature except. Kasama bang age? Yes. Ang hormones? Yes. Ang stress? Yes. Ang age, okay, kasama. Ang hormones? Yes. Ang stress, kasama. So, what is the correct answer? Letter D for number 1. Nakuha ba natin yan? Yes. Very good. Okay. So, that is your number 1. Next. Number 2. The client. Very simple lang. Simple term lang to mga to. The client who has terms. The client who has a fever is referred to as. What is the question? The client who has a fever. So, obviously, mali na ang letter dog. Okay, mali na yung letter dog. Sir, bakit mali? Hyperpyrexia. Ano bang hyperpyrexia natin? That is a very high fever. Usually, yan yung mga 41 degrees Celsius, 42, mga ganyan. Okay? Mali na din ba ang pyrexia? Mali na ang pyrexia. Sir, bakit mali ang pyrexia? Body temperature, okay, body temperature above the usual range. Above the usual range. Above the usual range. Okay, how about, sir, your afebrile? Ano naman, sir, yung afebrile po natin? A means absence. Okay? So, walang fever. No fever. How about, sir, your febrile? Okay, so that is the correct answer. For number 2, the answer is letter A. Okay, buka ba natin? Okay, very good. Simple lang, di ba? Napaka-simple. Okay, question number 3. Okay, number 3. Hypothermia. Okay, so core body temperature that is, it's a characteristic below the lower limit of your normal temp. Which of the following, okay, look at the question. Ang tinatanong po, class, nursing intervention is not included for clients with hypothermia. O, hypothermic yung patient natin. Mababa ang kanyang tinatawag na temperature. Are you going to provide a warm environment? Of course. Warm blanket. Keep your limbs close to the body? Yes. Why administer antipyretic? Hypothermic yung patient. Diba? God. Basic. Common sense. What is the answer? Letter C for number 3. Okay. Very simple lang. Next item, number 4. The body temperature may be measured orally. There are different modes, okay, of obtaining the temperature. But the question here is body temp taken orally. If a client has been taking cold or hot food, because it can affect, okay, the temperature orally, or fluids, or smoking, Diyos ko, dyan na naman yung mga batang mga insensitive. Okay? Huwag nyo lang silang pansin, maingay talaga dito. How long should the nurse, gaano ba katagal kang mag-aantay? Kung na mag-antay, hindi ka nang babalikan nun. Char! Okay, ganito. How long should the nurse wait before taking the temperature orally? According to Kushir, okay, if the patient is taking cold or hot fluids or nag-smoke yung patient mo, you have to wait for 30 minutes. Or mas accurate. Pagtingin mo sa choices, nga, walang 30 minutes. Usually, ganyan ang mga exams nyo sa board exam. So, be prepared. Okay, so kailangan mong i-convert yan. 30 minutes. Okay? So, test-taking strategy, guys. Okay, you can make use of your test-taking strategy. Remove your letter A and letter D. Principle of commonality and difference. Or bakit? Same. Parehas na ba yan? Ang 60 minutes by 2,400 seconds? Yes. Ang 30 minutes, mali na. Mali na. Mali. So, 30 minutes is equivalent to 1,800 seconds. What is the answer? Highlight natin. The answer is letter C. Very good. Okay. So, 4 na yan. Nakakailan ka na. Wala pa? Okay lang. Be positive. Darating din yung tamang numero para sa'yo. Okay, we proceed to your number 5. That's your body temp. Pulse. We go to your pulse. Pulse is commonly assessed by which of the following? Okay, select all that apply. Okay, so the question in number 5 is about assessing of your pulse. Okay, commonly your pulse is assessed by either palpation or auscultation. Diyos ko, kailan mo ginamit ang inspection sa pulse test? Kahit magdamag ka pang nakatunga nga dyan, hindi mo makukuha ang pulse niya. Your percussion. Okay, what is the answer? 1 and 4. Okay, we have 1 and 4. So the answer is letter boy. Yeah, boy. Okay, letter B. Okay, that's your number. Anong number na yan? Number 5. Okay, we proceed to number 6. A nursing student is assessing the client's pulse. Okay. So, ang nursing student, ina-assess niya yung pulse ni client. The clinical instructor, ikaw na si I, will intervene to which of the following? Select all that apply. Okay, you have to analyze the question. The clinical instructor will intervene. Okay. Ano bang ibig sabihin yan? Si nursing student, yung student mo nag-a-assess ng pulse. Ang tanong, the clinical instructor will intervene. Ibig sabihin, magi-intervene ka, papasok ka sa student mo. Kasi nga, magi-intervene ako, bakit may maling ginagawa ang estudyante ko? Ano yung maling ginagawa ng estudyante ko dyan? Select all that apply. So, the nurse will intervene. Okay? When the student palpates, tama. The pulse by applying moderate. Correct. Kasi dapat hindi hard. Kasi pag hard yan, mai-impede. Okay? Hindi mo makukuha yung accurate na measurement. Pressure with 3 middle fingers. Yes. Yan yung sabi ni Kojir. Palpation, okay, of the pulse. Applying moderate pressure with 3 middle fingers of the hand. Correct. When the student inspects, mali. Tama sana to, kaso nga lang mali yung inspects. When the student palpates the pulse by applying moderate pressure with 2